CAR T cell therapy is a type of immunotherapy. It stands for chimeric antigen receptor T cell therapy. And basically in this process, we take a patient's own T cells, which are a type of immune cell, and we actually remove them from the body through a special IV. And then we take these T cells to the lab where they're genetically modified in a way that they can recognize the specific type of cancer cell that that patient has. And these cells are grown in the lab, and once they reach a certain number, these T cells can then be infused back into the patient where they'll circulate through the body and recognize and then kill the cancer cells. And the type of CAR T cell therapy, the specific product that patients will receive will depend on their disease type, their overall health, and a decision with the provider as well. CAR T cell therapy has several major side effects, and these side effects can take place anywhere from a few days after the CAR T cell infusion to weeks to months or even years afterward. And the two key early side effects that we try to keep an eye out for are called cytokine release syndrome, or CRS, and neurotoxicity, or neurologic damage. And these side effects result from the inflammation that's associated with CAR T cell therapy. As you can imagine, when the CAR T cells are circulating through the body, they're trying to kill the cancer cells, they're dividing. This can be associated with a lot of inflammation. Cytokine release syndrome, or CRS, can cause patients to have fever, high heart rate, low blood pressure, and affect their organs. And neurotoxicity can cause patients to have confusion, trouble speaking, and even be as severe as seizures or coma. Some other key side effects of CAR T cell therapy include low blood counts, which can make patients require blood transfusions and increase the risk of infection, as well as low levels of antibodies, which are really important for fighting infection. And low levels of antibodies can also increase a patient's chance of developing an infection. So my mentor, Dr. Jordan Gauthier, who's in the CAR T cell group here at Fred Hutch, and I are particularly interested in understanding the toxicities or the side effects behind CAR T cell therapy. For example, we have a clinical trial that is testing a medication called anakinra, which is an anti-inflammatory medication that's used in conditions like rheumatoid arthritis, given with CAR T cell therapy to see if it can prevent cytokine release syndrome or neurotoxicity. And then some of our other projects include more computational projects where we're trying to see if we can predict which patients may develop low blood counts before they even get the CAR T cell infusion. And the knowledge that we gain from this sort of work will allow us to design future research studies like clinical trials or other sort of interventions that can really focus on these patients who might be more at risk of these more severe side effects.